Good evening and welcome to the latest installment of the Taylor Tuesday webinar series from Taylor Medical. I am Dr. Jeff Lehrman, a shareholder in Taylor Medical. I will bring in my other moderators, Dr. King and ldearmond, in a moment. Thank you for joining us. We're happy to get to spend this time with you. Tonight's webinar, as is the case with all of our Taylor Medical webinars, is being recorded and will be available with slides on demand after the fact. You can find that at www.taylormedical.com in the top right-hand corner, where those red arrows are pointing. You can see the word webinars. We've been doing these for several years. There's a whole library of webinars there, lots of valuable information, including tonight's information. A common question is, how do we get the slides? So that's how to get not only the slides, but a recording of tonight's webinar. If you're not familiar with Taylor Medical, let's spend a moment on why you should be. A common question among any of us in business is, how can I take home more money? Which is a fair question. That's why we go to work, or a lot of why we go to work. And one of the ways to take home more money is to make more. However, perhaps a smarter and more efficient way to take home more money is to spend less. And that is what Taylor Medical, in addition to other things, helps us accomplish. Taylor Medical is a group purchasing organization. And as a member of Taylor Medical, you are purchasing as part of a large group, which has professionals negotiating for us. And when purchasing from such a position of power, we have professionals who are able to negotiate very favorable prices for us. This is for big ticket items, for treatment chairs, and for things we buy almost every day or once a week, like gauze and bandages and tape and all kinds of things like that. And really anything in between that you can think of for your office. Paper, ink, right? All the stuff that we use. And you will find the great majority of the time, the prices are more favorable when you are part of the Taylor Medical group purchasing organization. If you are not sure, we can help you. If you send an email to the email you see on the slide here, admin@taylormedical.com, your questions can be answered. And if you're thinking, I don't know, I think I'm getting pretty good prices now, send them in and have them evaluated. There are professionals available at this email address, admin@taylormedical.com. You can just, every time you get that big order, right, there's a slip in the box that shows you what you ordered and how much you paid for it. You could just send that in and have it evaluated, and they'll tell you what those prices would have been had you purchased through Taylor Medical. So a smart way to do business. And with any questions, please reach out and email there. It's a pleasure to welcome in the other two moderators tonight, the first of which is Dr. Mike King, who many of you know well. Dr. King is a past president of the American Podiatric Medical Association, also a shareholder in Taylor Medical, and currently the chief medical officer of Upperline. We're also very pleased to have Lauren DeArmond with us, who is a Biomedix representative. Lauren is a strategic account manager at Biomedix, where she is responsible for creating, building, and optimizing community-based collaborative care networks nationally. Lauren also has a specific expertise in working with podiatrists and vascular specialists and helping them to collaborate with primary care providers in the provision of the services that we provide to our patients. It's now my pleasure to welcome in Dr. King, who will introduce tonight's speaker.
Thanks, Jeff, and thank you, Lauren. Welcome aboard, Lauren. It's good to have you with us. You know, I'm really sorry we couldn't have our regularly scheduled speaker here. No, I'm just kidding. Actually, it's exciting is that after 20 months of doing these every other Tuesday, we thought it was the perfect time for our usual host and moderator, Dr. Kraus, to make his presence seen as a speaker. So we're very glad tonight to have our own Ira, who I know many of you have been watching with Jeff and I and Steve a couple times and John and the whole team and over the last 20 months. So we really, really appreciate it. But tonight we get to hear Ira as our speaker. And Ira's got a great topic about just a phenomenal corporate member, partner of Taylor, and that's Biomedix. So Ira, I'm going to turn it over to you, and Lauren's our color commentator for the wild card tonight. And the wild card is Dr. Krause. Ira, take it away.
Thanks, Mike, and thanks, Jeff, and thanks, Lauren. It's interesting. I have been using Biomedix and the PADnet product for many years in my practice. There are a multitude of products that are out there, and I think that every practitioner needs to find the product that delivers the best message to them. And I think what's critical for me is looking at how products advance themselves. What's their longevity in our space? How have they improved their technology? How have they provided better care to our patients? And for me, it personally has been with my relationships and work with Biomedix. So if you look at Biomedix as a company, they've been out here for 20 years doing vascular testing. They got involved very early in our world as podiatrists and podiatric physicians and surgeons in treating lower extremity vascular disease and diagnosing it. I think that when you look at the volume of testing that's been done, there's been 1 million tests performed nationally and dated and archived and looked at. 5,000 PADnet devices are deployed. Think about our community as podiatric professionals. There are probably about, I would say, licensed 17,500 professionals. I'd say there's probably about 12,500 that are working actively. And I would say of those 12,500 that are working actively, there are a significant amount in the VA, significant amount in managed care companies, and there are probably 9,000 independent practitioners. And the fact that there are over 5,000 PADnet devices deployed shows you that the majority of members, our professionals that have been using vascular technology, are using the Biomedix device. There are 1,100 test sites with 450 read sites. So what that means is that you have the option as a practitioner to perform the test and read the test if you feel comfortable, or you could perform the test and have the test read by a vascular specialist that Biomedix will help provide for you. They're HI Trust certified and FDA cleared technology. Basically, for me, I'm a simple guy. It means they're meeting all the standards that we need to make sure that their product is certified to be able to provide the information that we need to make critical care diagnoses for our patients. There's a robust and growing patient portfolio. They are continuing to grow as a company, and they're continuing to help provide for our patients. And I think that one of the interesting things that happened was I attend a lot of podiatry trade shows. It's interesting for me as my role has changed from being a representative of the profession now to being more in the vendor space. But ultimately, my goal is the same, is to make sure that my colleagues have the best tools and the best technology to achieve good patient outcomes. And what I appreciate about the fact of the Biomedix technology is the evolution. And I think that one of the purposes of this individual program is to not to relaunch anything, because Biomedix has been out there, but to kind of bring people up to speed to the changes that have been made to show you that as a company, Biomedix is committed to the outcomes of for our patients. So the original PADnet 2.0 machine, although it was designed as a stationary clinic device, back in the day, I used to move it from clinic to clinic, but it was definitely more difficult. When you look at the PADnet 4th generation device now, it fits into a backpack for portability. You can bring it to multiple clinics, ABIs, TBIs, PVRs. You can build multi-level services. The product is efficient. It just makes your life easier, but it gives you the technology and the information to provide better care for your patients. And then, of course, you have the PADnet Express, which is relatively new. It fits in a desk drawer. It leverages AI technology and million-plus historical studies for test interpretation. So when you think about, and this is relatively new, everybody thinks about the PADnet machine as a test that takes 20 to 30 minutes to perform. There are multiple variations of what's available right now for you to perform quality care on your patients. You have the PADnet Express, which fits into your pocket. It's a 2-minute test. There's no data entry necessary. It supports behavioral health assessments, fall risk assessments, and SDOH surveys. So it's not just a vascular testing machine. And I think that what we need to do as practitioners is find the technology that's going to provide us the most information to deliver the best outcomes to our patients. And for me personally, I believe that Biomedix is one of those companies. When you think about the 4th generation PADnet machine, ideal for primary care, but it's also ideal for podiatric physicians. It's ideal for endocrinologists. There are a plethora of physicians that could benefit from having the appropriate technology in their office and the importance of utilizing the data for diagnostic skills and outcomes. ABIs, TBIs, segmental PVRs, it can be performed by your medical assistant. I would suggest that you look at your LCD policies and make sure that this can be performed for the most part when physicians are in the office. There are some companies, some LCD policies that may allow some different alternatives. And I think that that is very, very important for understanding everything is understanding the guidelines that are pertinent to your location where you are. So when a lot of the biggest issues in practices, especially busy practices that are looking to provide quality care, but maximize the time that's available and be efficient, you've got to set up clinical protocols. The new development with the PADnet 4.0 has allowed for you to look at those things. The speed is significantly improved. I can attest to the early 2.0 machine where it took 20 to 25 minutes to perform a test. It was not advantageous from the standpoint of efficiency, but Biomedix responded to that by developing products that are more efficient. So the new system supports either a 2-minute screening, a limited arterial study, which is the 93922, which is the lowest level of testing we perform, a full arterial study, which is the 93923, as well as even a full stress test at a 93924. There's a use of new technology with distal sensing probes to accelerate the collection of blood pressure. Obviously, our goal is to make this as efficient and effective as possible. We can do full arterial studies, the 93923, could do PVRs at toes rather than just above the knee. There is significant options with reducing the amount of data that's required. I know that they can do interfaces with your system, so a lot of the data could come over. That would be based on system to system, but I would contact Biomedix about an HLA7 interface. You can customize your testing options, and system remembers the segment preferences in order. So if you set up clinical protocols in your office and you want to follow certain pathways, Biomedix has the intellectual technology to be able to do that for you. Security. We all know that in today's world, we have had cyber hacks, We've heard it about on multiple times from our malpractice carriers, from internet carriers. And I think that utilizing a company that has done everything that they can to make sure that your patient's data is protected is critical. So PADnet is HIC Trust certified, offering you the highest level of protection against ransomware. The data is encrypted at rest and in transit. It does not reside on local devices which can be lost or stolen. Back in the day when we had our original 2.0 machines, our data was shared or stored on our laptop, and could easily have been hacked or taken away. PHI is no longer stored on the laptop device at all, and there's no Bluetooth used, offering protection against this vulnerable technology, and can be used on patients with pacemakers. So again, when we look at and reflect back on the changes of what has happened with the PADnet machine, and I think that's critical when you look at a lot of products in our space. Sorry, very delicate computer. But when you look at the products that are in our space and you think about how many companies will sit on their laurels and will not make changes progressively that will help to get us better outcomes and provide better data, I think that that's what we need to look at. And Biomedix has made those efforts to do that. Okay,
I'll move it up for you if you can't.
It's not moving, Mike. Can you do that for me?
There you go.
Thank you. So when you think about access, the data is not stored in silos. It's not located in the traditional places that we would have looked at it before. You have cloud-based access to all your records. So if you have multiple clinics and you're in different locations and a patient shows up in a different office, you're able to access the results and access the data. Many of us have clinics, especially now with what's going on in the world. Every clinic is not open as many hours as they were. Patients may be coming in for results at different locations. And I think that the fact that you can access that data at whatever location you're at is also important for the patient. You know, back in the day for me, I hated when a patient showed up at a clinic to get results and I didn't have it. We didn't access the data, whether it was MRI or CT or vascular testing. The fact that we didn't have it, that made the patient inconvenient. So what's comfortable and what's important for me is that when you use this technology, you're able to access this information wherever you're located. It reduces the potential risk of attacking your local network. We all have, the paradigm has changed. I never thought of cybersecurity. I never thought of being hacked. I never thought of my patient's information being stolen. We're in a new generation and a new time. And I think not only do we have to be responsible for some of these things, but having vendors that are contributing to making sure that that doesn't happen, I think is critical. And that's another thing that Biomedix offers as a partner. Mobility. We talked about having multiple clinics. I myself had 6 clinics when I was in clinical practice, and we had to have a couple of machines to make sure that we could provide care to all of our patients. But having the mobility, having a product that you can move from clinic to clinic, store it in a backpack, multiple clinics. You want to do home health visits, nursing homes, skilled facilities, even doing it at a health fair. If your practice is doing internal marketing and you want to be able to provide these tests as a screening exam, which was very instrumental to my practice, you have the ability to do that. So I think that utilizing a company that provides these services will make a big difference for you and your practice. Interoperability. So when you think about, would it be appropriate to say that I am internet challenged and I am technology challenged? And the beauty about PADnet is I'm going to make an assumption that most clinics have Wi-Fi. And once you have the ability to connect to the Wi-Fi and open a web browser, you have the access of doing Windows, laptops, tablets, Android, smartphones, iPhones. There's integration with the EMR. So Biomedix has the ability to an HLA7 interface where the results actually will import into your EMR. So you don't have to chase after the results. You have those options, and those are things that you have to talk to Biomedix about to make sure that you can take advantage of what they have to offer. Flexibility. When I came out of school, although I did a good residency program, I would probably tell you that I did not do a lot of vascular testing interpretation. So with the fact that the way vascular testing is coded, you have what's called a global fee versus a technical and a professional component. So when I was doing in my clinics vascular testing, I utilized my local vascular surgeons in my community, which helped increase my credibility to read my studies. But you have the choice, if you're comfortable, to interpret your own studies or leverage the vascular oversight and have vascular physicians dedicated to review your studies, perform those reads for you. So that is your choice. You have the flexibility to make the decision on what you want to do in your practice. You know, I've always looked at devices, and I like slides that compare things. So when I look at the PADnet machine versus the other products in the same space, I think it's important to look at what are the differentials. What is different about the PADnet machine versus your other competitors? And what I also respect is that although there are multiple competitors on the market, the reference here is just other ABI devices. So when you look at ABIs, the PADnet performs it, and there are other devices that perform that, and you can see there's an asterisk that references only if obtaining systolic blood pressures from both arms, unless contraindicated. Clinically valid PVRs, TBIs, which are toe brachial indices. Most of the other products have add-on costs, again, evaluated on your own. Segmental PVRs, interpret your own studies, consent through a vascular oversight through the cloud, the certification through HI Trust certified software platform, Bluetooth secure vulnerability, extended warranties, EMR interfacing, venous testing, cloud storage. I think there's a lot of things that all of you as individuals need to look at to make sure that you're providing the best qualified product to provide the best qualified service to your members. I've worked with Biomedix for a long time. And what's important to me is they've given back to the profession. They've worked really, really hard to make sure that the devices are current and up to date. And they've made sure that as podiatric physicians, we're able to provide the best quality care for our patients. As far as application and podiatry application, this test can be performed by medical assistants. It is not operator dependent. There is training that will help make sure that your staff is capable of doing what needs to be done. The time to test. So if you're doing a screening ankle PVR, it's 2 minutes. If you're doing the lowest level of vascular testing, which is single level, which is an ABI and angled PVRs, it takes 5 to 7 minutes. And if you're doing a multi-level ABI 3 levels, it's 15 to 20 minutes. Reimbursement, the lowest level of 93922 is $91, and that's global. And what I mean by global is means that you are going to be interpreting the test. If you are having a vascular surgeon do the interpretation, there will be a reduction as you're only billing the technical component. And you have the ability of billing multi-level, which is 93923. Approximate reimbursement is about $140 for the global testing. You can also do that where if you don't perform the read, you can farm that out. And there are also E&M codes that can be used follow-up with your patients as you discuss the outcomes. You have patients that are going to have clinical symptomatology that are going to require follow-up care versus those patients that, thank God, have a normal result. And we tell them that we're going to follow up with them in a few months just to make sure everything is normal. So I'm going to turn it back over to my co-moderators. I'm going to ask Lauren if I left anything else out that she wanted covered about Biomedix and PADnet.
Lauren, I think you're on mute. No.
You're on mute, Lauren.
So while we're waiting for Lauren to come back, I want to add a couple of questions for her. And since we got you and Jeff together too, let's talk just a minute about the single level versus the multi-level testing, because it varies from state to state, what, scope, coverages, et cetera. And so maybe you could just take a minute between the two of you to talk a little bit about single versus multi-level. And we know the coding differences. We can see the reimbursement. Obviously, there's more work involved, et cetera, but there's still some issues between state to state. And I think some people are doing very baseline single level exams and billing for multi-level, which we know is not a good thing. So just maybe you guys could talk about that for a second.
Well, the first comment I want to make in responding to what Dr. King said is to always keep in mind the umbrella of medical necessity that governs everything that we do. So there may be occasions for multi-level, there may be occasions for provocative functional maneuvers, but be sure the medical necessity for what you're doing is present and documented. And where I see colleagues of ours get into trouble where they just treat it as a matter of course. For example, every single patient gets a provocative functional maneuver. That should not be the case, that every single one without any consideration gets it. It might be the case that most of them need it, but what governs all of this is that the medical necessity needs to be present and documented for anything we do.
Lauren, you're still muted. I don't know why. I wish I had control to change that, but I can't.
Shoot, I had some good questions for you too.
Maybe it's an omen from God.
Lauren, if you haven't tried already, if you just leave and come back, I've had good experience with that. Also, I've had a problem with a browser before. Internet Explorer did not work, and then Chrome did. Some ideas.
So I read, and so we're waiting for another coding question for you guys. This came up through the chat. Is the PADnet Express billable under Medicare guidelines?
So what I can tell you is that the PADnet Express is billable as a 93922, Mike. It's a single level exam. It is not something that is going to be, you're not going to bill multi-level. It's meant, I hate to use the word screening, but it's more for patients that you suspect may have a problem. They may need further testing later on, but the PADnet Express is billable as a 93922.
So since we were talking about that, do you guys know states that might be multi versus single level? I mean, and that's a very provocative question. I apologize because Lauren's back too. So it's a very deep question, but for example, California can be multi-level, Florida can be multi-level, Georgia can be multi-level. There are a bunch. Maybe it's easier to think of the ones that aren't, not like Massachusetts, Alabama, Mississippi. I think it's just, I guess what I'm getting at is that everybody should make sure you look at the LCD for how you can bill these under Medicare guidelines. That's the bottom line I'm sort of moving toward is, where you're at, take a look at what's covered and what's, even though your scope may be greater than you realize, that doesn't necessarily mean they're going to allow you to the multi-level testing. But
definitely.
Hey, Lauren, I wanted to throw out for you, Ira brought up two terms. Jeff, I'm sorry, I've just had a bunch of questions down here.
Okay.
Ira mentioned two terms, Lauren. Maybe you can elaborate on them just a little bit.
Okay.
One is the high trust certification, which I think is really a big deal because, none of us want to get hacked.
Mm-hmm.
And the loss of PHI now is devastating.
Absolutely.
Devastatingly financially. And secondly, is what's this HLA-7 interface stuff that I keep hearing about? I know, but I want to hear from the master why those two things are so important to us.
Sure. So to start with the high trust certification, this just really goes back to, like you said, protecting PHI. It is the highest level of protection in healthcare technology when it comes to protecting PHI. So Biomedix as a company spends a lot of time and resources to keep our high trust certification up to date. That certification covers our PADnet, our Express, the cloud portals associated with it. All of our technology and those cloud portals are high trust certified. So as I mentioned, we keep that up to date because it is so critical. And it seems like every week we're seeing, news reports of major hacks and all of this loss of information. And it's truly devastating and can really devastate these smaller clinics and smaller practices. So that's so critical. It's really important when you're considering technology that you look into that, you find out if your healthcare technology is high trust certified, and that's something that we can stand behind across all fronts. You also asked about HL7 integration. Yep. And so HL7 is
I said really HLA, but you don't have to talk about psoriatic arthritis. Sorry. HL7, yes.
Yes. So that is just our ability to integrate with your EMR. We've already, been working with lots of podiatric customers that are integrating with TrackNet, with SAMI. Obviously, those are now with Modernizing Medicine. But we can integrate with nearly any EMR that you might be using in your practice. That's something that you can speak with us directly about. And we have a network manager and a team that can help with that. Now, there's sometimes cost associated with the integration on your EMR side. We used to charge a pretty hefty penny to work through the EMR integration because it is such a lengthy technical process. But with most of these EMRs, we are now able to do that and willing to offer that as an inclusion to your PADnet purchase. So again, that's something to reach out to me directly, reach out to support at Biomedix if you have any specific questions with your EMR. But most EMRs we are able to integrate and happy to do so. Great question.
Thank you. Jeff, anything you want to throw in there? I got more. I didn't want to be the hog. So I already got a question for you then. When somebody's looking at integrating vascular services into their practice, so there are lots of different systems out there, and some really good ones too. I guess my question leads toward the proper utilization. Jeff hit the nail on the head when it comes to medical necessity, but is there a type of practice or a type of, I'm sorry, I'm trying to phrase this the right way. Is this fit in everybody's practice, or is there a particular type of practice this is better for, or is it universal, or how does PADnet fit into the average podiatric practice? So
that's a great question, and I think overall, if you were to look at the data, and let's just look at the clinical symptomatology, signs and symptoms. I think if you look at the data, I would say that of patients that are diabetic and 55 years of age or older, you're probably going to have about a 29% incidence of PVD. If you have patients that are smokers that are 55 years and older, you're going to probably have that same similar 29%. If you have patients that are 75 and older with no comorbidities, just age-related 75 years old, they're going to have 29% of vascular disease. So when you look at the numbers, Mike, I think that you have to look at the type of practice that you have. And I think you have to look at what type of services you're willing to provide for these patients. And also how I think you want to establish the reputation of your practice. I can tell you that back in the day, I remember when I was getting ready to start doing vascular testing in my community, I was in a very, very well-respected vascular community in Chattanooga. We had some of the leading cutting-edge endovascular surgeons in the country. And I was very, very concerned about how my introduction or implementation of this type of technology was going to affect my reputation, my referral sources, however you want to look at it. And it turns out that I was fortunate from the standpoint that my local vascular physicians were so busy and inundated that they trusted the results and outcome and interpretations that we determined, where I could call up a patient and say, hey, I'd call up a colleague and say, hey, Mrs. Jones needs a arterial study. It saved those patients time because, I can't speak for everybody around the country, but, here, some of these labs for the screening tests, and I hate to use the word screening, but lower level tests are so bogged up that these patients wait for an extended period of time to have this simple test that can be performed to determine when they're going to go to the next level and what needs to be done. And I think ultimately you have to look at your practice. And it was interesting. Although my practice was more critical in ischemia limb salvage, I will tell you that in Chattanooga, we had a significant amount of blue-collar employees. We are the hub in the United States for logistics, truck drivers. I can't tell you how many patients came into my practice that were smokers at the age of 45 or 50 with calf pain that just thought it was cramps from sitting in their truck smoking cigarettes. And we did tests and we saved their lives. So, I really think it's what you as a practitioner want to offer as care for your patients, Mike. So I think it's a multifaceted thought process that you would look at when you're doing that. I mean, and I think both you and Jeff, having had clinical experience, probably would have a similar answer to what I'm saying.
And I'll add to that, keep in mind the risk management, right? So Dr. Krause talked about the good medical care, of course, but there's also a risk management aspect to this where we see, doing some defense work, too many bad outcomes which were preceded by the patient not having the arterial studies that they should have had done, like a procedure being done, sometimes even a minor procedure, sometimes even a matrixectomy, for example, in a compromised patient that didn't have adequate vascular interrogation prior to the procedure. Limb salvage, amputation, so many of the procedures that we do with the presentation of the patient, a non-invasive vascular study should be done, procedure or not, but certainly with many of the procedures that we're doing. So in addition to the good care and treating our patients the way we would treat our loved ones, also consider the risk management side of this.
That's a great point, Jeff. And I think, Ira and I now part of Upperline, which you mentioned earlier. We have 160 doctors around the country now. And one of the key parts of our platform is screening. And the Medicare Advantage plans, even though they give us all a very hard time, understand, to Jeff's point, that if we can identify that risk sooner, we can prevent downstream spending. if we as podiatrists are the gatekeepers of that and save downstream spending, we can then legitimately ask them to make our fee schedules better. Because we're saving the system money, we're saving limbs, we're saving lives. And just as a little commercial for Biomedix, and since we're talking about, Upperline has adopted the Biomedix platform. And so we've instituted that, at least in part and parcel, in our clinics now. And so, I think back to Ira's point and Jeff's point about the risk is that we have the chance to be the gatekeepers. Yes, we get scrutinized. Yes, they can be challenging. But back to Jeff's earlier point is it needs to be medically necessary. It needs to be well documented. If you have those two things, then you might have some battles, but there's a better chance of winning those battles if you have those things.
Right. And there, as you just stated, Dr. King, that being able to be a huge part in reducing the overall cost of healthcare is critical. And you are at the front line and you see these patients regularly and you're the ones they have the relationship with. So really being those frontline physicians that have the relationship, that have the opportunity to provide point of care vascular testing where it's convenient for the patient. You're not, bogging up those vascular labs, which I've heard the other end of it. I hear vascular physicians tell me all the time, we want our podiatric partners to be testing. It benefits the patients rather than trying to get them shuffled over to us. It really does help the patient, helps the community as a whole. So that's huge. And go ahead, Dr. Krause.
Well, I was going to say, Lauren, reinforcing what you're saying, that's what helped build our credibility in this community. For me in Chattanooga, my vascular surgeons got very comfortable with me being able to call them and say, hey, I've done a test on so-and-so and they need an arteriogram. Instead of sending them over first to have a vascular screening and then get scheduled for an arteriogram, I was able to circumvent the delay in care for those patients. And they developed a level of confidence in working with us. So I actually think it improves our position as podiatric physicians and surgeons in the medical community.
1,000%. And Dr. Learmond, you talked about, risk assessment and being able to have that documentation. I think that's another piece where PADnet has this option to send these studies to a vascular specialist for vascular oversight. So having the sign off on, a PADnet study from a vascular specialist that says there's no evidence of vascular disease is really a valuable piece to this platform for that risk management part. So that's certainly unique with PADnet and that, cloud portal that allows that collaboration and provides the documentation needed, prior to doing a procedure.
Excellent. Ira, we're a little bit early, but anything you have to
to
close us out with? I'm out of questions.
And you know what? It's okay that we don't always go the full hour. I think it's really the content that's critical. Mm-hmm. And for me, it's been an absolute pleasure to work with, obviously, two people who I revere and respect tremendously. And I can't wait to lecture with in November together. Mm-hmm. As the three of us will be together at the same time. And I just think that, Lauren, I appreciate Biomedix's desire to sponsor and educate and make sure that we, as Taylor Medical, provides the appropriate tools for our physicians to be able to get the best outcomes for their patients, most importantly, and to generate revenue for their practices, which it's just as important not to talk that patients are not, but our practices' financial health is as important as our patients' health, because if our practices are not financially healthy, we can't provide the care that's needed for our patients. So I'm going to close it out to my moderators, because for once I don't have to close out a presentation.
Well, thank you for your attention. Thank you to Biomedix and Lauren. So happy to have you. Thanks to those who attended. A reminder that this webinar was recorded, as are all of our Taylor Medical webinars. We shared the link and where you can find those webinars at the beginning. And please plan to join us in 2 weeks for our next Taylor Tuesday Taylor Medical webinar. You can see that's scheduled for 8 p. Eastern Standard Time on October 19, which will be presented by Sayors.
Thank you for having me. We love partnering with Taylor.
Mike, Jeff, Lauren, it was a pleasure. I hope you all have a wonderful evening, and I will see you all soon.
Thank you, Dr. Krause, for a wonderful presentation.
Thank you, guys.
Have a great night.
Appreciate it.